Okay, so we're going to review the heart today. And again, most of this is in your old AP1 or AP2 classes in your textbook. So again, your new textbook, your pathophysiology, I believe you're still using the Lippincott book. And the structures are important. So get the A&P, the anatomy and the physiology of the heart. So this right here is a frontal section of the heart, where it's open, right? Again, if we were in lab, we'd be looking at the sheep heart or the pig heart. So I like to describe the heart in two different ways. Sometimes you look at just the upper part of the heart, and sometimes you look at the lower part of the heart. So it's an upper and lower heart, and they're chambers. Then you could have the left side of the heart and the right side of the heart. And they're completely independent of each other, as are the upper chambers and the lower chambers. But really, the left and right of a human heart is completely independent. And I'll tell you right now, the right side of the heart, right here, is where all the deoxygenated blood comes back to the heart. And this is called the right atrium. So the right atrium, very important that you know this. All of the deoxygenated blood comes back to the heart, to the right atrium, which means from the upper body, and that comes from a great vessel called the superior vena cava. And the superior vena cava drains deoxygenated blood from the head, the arms, and the upper torso, and enters into the right atrium. Doesn't show it on this picture, but there's an inferior vena cava that drains deoxygenated blood from the legs and the lower torso, and that comes into the right atrium. And if we were to look at this blood in the absence of all the oxygen it needs, it's going to appear blue. And deoxygenated blood is blue on models in real life. Now, there's a third way that deoxygenated blood goes into the right atrium, and that is from the heart muscle itself. And this is very important. The heart is fed by arteries. Now, I'll tell you what the definition of an artery and a vein is in a minute. But the heart muscle itself, which we call the myocardium, which is cardiac muscle, needs oxygen to contract. So once it uses that oxygen to contract, it has to bring the blood back to the heart. But it doesn't come from inside of the heart. It comes from a circuit called the coronary circuit. So the third way that deoxygenated blood gets into the right atrium is through the coronary circuit via the coronary sinus, which is a vessel that's posterior in the heart, which you'll see in a few slides. But the takeaway here is that all the blood that comes back from the body and from the heart muscle itself first enters into the right atrium. And this is coming from two different sources. The inferior and the superior vena cava are draining blood back to the heart that's deoxygenated from the systemic circuit, from the system, the head, the arms, the torso, the legs. The coronary sinus or the coronary vessels are draining blood into the right atrium from what's called the coronary circuit. And I'll explain that in a few too. So that's two different circuits we're talking about already. The systemic circuit, which is blood that comes from the rest of the body. The coronary circuit is just from the heart. And that's the one you need to know the best when you're going into your pathophysiology and lecture, is coronary artery disease, CAD. Now, coronary arteries come from a different source. Now, the right side, again, is deoxygenated blood. The bottom chamber of the heart is the right atrium on the right, again, dealing with deoxygenated blood. Now, let me just mention the left side. The left upper chamber is called the left atrium. The bottom chamber is called the left ventricle. Now, the left side of the heart is receiving oxygenated blood. And where does oxygenated blood have to come back from to be oxygenated? Anybody know? Like, where does the oxygen come from? What system?
Lungs.
The lungs.
The pulmonary.
So as opposed to The right side of the heart, where it's coming back from the systemic circuit and the coronary circuit, the left atrium is receiving all of the blood that's coming back from the lungs. And now that circuit in the lungs and back from the lungs to the heart is called the pulmonary circuit. Sometimes they call it the central circuit because it really doesn't leave the heart and lungs. It just, that blood just stays within those two systems, the pulmonary circuit and then back into the cardiac circuit, so to speak. So all the oxygenated blood from the lungs enters the heart via the left atrium. And the bottom chamber is the left ventricle. Everybody follow me so far? Let me just get in your face right now. So what are we talking about here? So we're talking about supplying the system and the heart with oxygenated blood. Now, why is that so important? What is the body, every cell in your body, your brain cells, that stupid little pinky toe that we have, the skin and everything down there. What do we need oxygen for? What do we need? What's that 3-letter energy molecule that provides energy for every cell to function and divide if it needs to?
ATP.
ATP, right? So if we have no oxygen, we have no ATP, we have no muscle contraction, we have no cell metabolism, and dead we are, right? So we need to get oxygen to every tissue in the body, especially the brain, because the brain's going to control everything. The brain's going to control everything, right? So by definition, what is an artery? Does that take blood from the heart or does it drain it back to the heart?
Away from.
That's right. So the artery is a vessel that carries blood away from the heart. I don't care if it's oxygenated or deoxygenated. That just live with that definition. So then by elimination, a vein is any vessel that drains blood back to the heart. So veins take blood back to the heart. Again, I don't care if it's oxygenated or deoxygenated. But remember, there's two sides to the heart, right? The right side and the left side. So which is the deoxygenated side, the right side or the left side?
Right side.
Yeah,
The
right
right
side,
side.
right side, very good. Right side, yeah, so always remember that, it's the right side. So let's see, smarty pants, if you know this. Remember I said the left ventricle receives the blood from the lungs? I'm sorry, the left atrium receives blood from the lungs. So what do you call the vessel that comes back from the lungs and goes to the left atrium? What do you call that vessel? Is it an artery or vein, first of all?
Pulmonary vein.
It's a vein, and somebody said pulmonary. What a smart bunch. Because it's the pulmonary circuit. But let me ask you this, another smarty pants question. What color is that blood coming back in the pulmonary vein? Vein.
Red.
Red.
Holy shit, you're right. That's right. That's right. Very good. So that's kind of a contradiction to everything we've learned. Like a blue vein, red artery. It's not always like that because we're in the pulmonary circuit, right? We're in the pulmonary circuit. So the pulmonary vein is oxygenated blood, but it's coming back from the lungs. Very good. Now, what about the blood going? And I didn't get there yet with our picture, but the blood has to go from the heart to the lungs. So, and I'll tell you later, it comes from the ventricle, and it goes into this big vessel called the pulmonary trunk. And what are the vessels called that takes the blood from the heart to the lungs? What do we call that vessel?
Left and right pulmonary arteries.
Oh my God. Oh my God. I'm glad we started late today. I think 9:30 would have been too early. Amazing. What color are those pulmonary arteries?
Blue.
They are. Holy shit. Excellent, excellent. So just keep those things in mind, some of those definitions. Now, I kind of talked about it quick, but remember, there's 3 circuits. You have the pulmonary circuit, which is all that, that blue is, an artery and red is a vein. So that's pulmonary, between the heart and the lungs. The systemic circuit comes back from the whole body. So, of course, there's going to be arteries that take the blood to the full system. And there's going to be arteries that take the blood to the 3rd circuit, which everybody forgets about, but it's the most important for this class, is the coronary circuit, right? The coronary circuit because that's feeding the heart muscle itself, the myocardium, right? So again, we're probably going to go over this, but what are the three muscle types? There's cardiac, obviously, which we're going to live with knee deep for the next few weeks. What are the other two muscle types? Anybody remember?
Skeletal and smooth.
Yes, smooth, also known as visceral and skeletal muscle. So unfortunately, in this class, we're not going to talk much about skeletal muscle, but know this: skeletal muscle is the only involuntary muscle. I'm sorry, the only voluntary muscle where we can control the movement with our cerebral cortex. And sometimes we refer to that as somatic. And we'll look at the histology in a few. And then you have smooth muscle, which is visceral, which is involuntary. And it has a different look to it. So remember, smooth muscles is important for this class because you're going to talk about blood vessels. And all blood vessels have a very important inner layer or middle layer, really, that's made of smooth muscle, which is involuntary. It needs control of the nervous system, especially a nervous system that we're going to call the autonomic nervous system. So that leaves us with cardiac muscle. So what's so important about what's so special about cardiac muscle versus the other two? Like almost crazy, it's so different. How would you describe it? There's one word. It's going to be on the exam. It's like the second question, probably on the quiz too. Like if you had to describe the not anatomical, but physiological function, what would you say about cardiac muscle? This is so important. Is your hand up, Anita? Or you just like,
No, I was just
I thought you were saying talk to the hand, Fizia. Talk to the hand. So what is so important about it?
well, self-starting.
Yeah. Excellent. And there's a long word that I don't know how to spell. It's called autorhythmicity. It has autorhythmicity, right? So if I ripped Brittany's heart out of her chest, right, and I put it in an isotonic solution and the right sodium, potassium, chloride, calcium was flowing, it would continue to beat on its own. Not forever, and it'd be in fibrillation in a couple of minutes, but it has its own pacemaking potential. It can start its own action potentials, is what muscle needs to contract, right? Let's face it, of all the tissue types, like you have, you ever hear of epithelial tissue, right? You've heard of connective tissue and nervous tissue, and then there's muscle tissue. Those are the four main tissue groups. So I'll say it again for the recording. You have epithelial tissue, you have connective tissue, you have nervous tissue, and then muscle tissue. I hate to say this, I hate to stigmatize muscle, but it's not the smartest of the tissue because it needs something else to do its job, right? Like skeletal muscle needs a nerve impulse. Smooth muscle needs a nerve impulse, but cardiac muscle is a little special because it has autorhythmicity. It has its own nervous system, so to speak, its own action potentials. Everybody got that? But it's still controlled by the autonomic nervous system. Like you couldn't speed up a heart rate or slow down a heart rate or contractility unless you had the autonomic nerve impulse. So really, again, not to stigmatize muscle, but all it does is shorten. That's all it does. And that's what a contraction is. It shortens. Cool? And without ATP, that shit's not going to happen. Okay? Without calcium, right amounts of calcium, that's not going to happen. If the muscle tissue itself is injured or there's a problem with blood flow, and that's really what this class is all about as far as cardio, is there a problem with blood flow getting to the heart muscle itself? And that's called ischemia, which you'll learn. And that's going to show up on an EKG. And it's going to give the person symptoms, of course, like chest pain, arm pain, neck pain, back pain, and they could belly up, right? They could be unconscious if they're not getting enough blood flow to that cardiac muscle. And that's what the heart is made of. Are we clear? So these arteries you're talking about are really important. Getting oxygenated blood to the cardiac muscle. We call it the myocardium. I might use that interchangeably. Everybody see this again? Okay, we're back to the nuts and bolts. You should have a good understanding what an artery, a vein is, and the three circuits, you'll get there. So now the lower chambers, left ventricle and right ventricle. So the right ventricle is going to have deoxygenated blood, the left ventricle is going to have the oxygenated blood. So now it happens all at one time. I don't want to confuse you, but there's only one way to go through the circuit. Let me see what the next page shows us. Same thing. So blood comes into the right atrium and the left atrium at the same time. I'm sorry, left atrium's here. Left atrium at the same time. And then blood is going to go down into the ventricles. Okay, so this is not the best picture, by the way. Now, there's only 4 valves in the heart. So let's introduce 2 of them right now. So between the right atrium and the right ventricle is a valve called the tricuspid valve. And this is an AV valve, or an atrioventricular valve. So the left side, again, it's not showing it great, but this is the bicuspid valve. So the bicuspid valve is between the left atrium and the left ventricle. And that's also an AV valve. So this is blood within the heart, right? It's not leaving the heart. It's not leaving the heart at this point. It's just going from the top of the heart to the bottom. And mind you, that the blood enters the ventricles at the same time, left and right. Everybody clear with that? Everybody okay? So these AV valves, left side is called mitral valve, also known as bicuspid, or bicuspid, also known as mitral valve. It's called mitral because the cusps of the valves looks like a bishop's hat, a mitre. So the left side, I'm sorry, the right side is the tricuspid valve. Okay, and you'll notice difference, and we'll get to a couple of other slides that show you a close-up of the valves, and I'll show you the parts. So one more thing in your face. What is the function of a valve?
It prevents the backflow.
Yeah,
of
Nora,
blood.
you're right on your game. It prevents regurgitation, which is backflow, and you can't have that. So here you go, smarty pants. Let's see if you're on your game. It's like 12 something, it's almost 12 o'clock already. So let's say I have a problem with my mitral valve. Are you with me? Where's the backflow going to be? What chamber right away? My mitral valve, which is bicuspid.
Left ventricle.
Left atrium,
I'm sorry.
because it's going the other direction. No, that happens all the time. That happens all the time. So yeah, so that would be the left atrium, because that's where it came from, because the blood's coming in the top of the heart first. I hope I made that clear. Like it's coming from the systemic circuit, the coronary circuit, into the right. See, this is my right hand to you, right? And then the left is coming from the lungs into the left atrium. Everybody clear with that? So here's a smarty pants question. Now, if I have a problem with my mitral valve, right? And Judy knows now that it's back up into the left atrium. Am I going to have edema, which is swelling of fluids within my interstitial tissue? Am I going to have edema in my systemic body, like in my arms, my legs, or am I going to have edema in my lungs, which is called pulmonary edema?
Lungs.
Yeah, you got it. So any left side valve problem, which you'll meet another valve in a minute, is going to lead to what's called pulmonary edema, which is going to give you a congestive heart failure. And if you have a problem with your tricuspid valve, the backflow is going to be into the what chamber? Not the left atrium, but the
Right atrium.
right atrium. And that comes from the systemic circuit. So you'd have systemic edema. You'd have swelling in your ankles, your hands, your fingers, your arms, you understand? Even in your abdomen. And that's also a result of congestive heart failure. Very good. Excellent. Excellent. So let's go back to our stupid picture. Let's see what else I could get into on here. So now the blood is in the ventricles. I don't know if this is going to show it too good. So blood coming out of the right ventricle is going to go, now this is the right ventricle here, everybody see? The right ventricle is going to send blood out of the heart now and into a large, great vessel called the pulmonary trunk. And that's right here. And then the pulmonary trunk will branch to the pulmonary arteries, like you told me before, is going to the lungs. And it's blue blood. It's because now we're in the pulmonary circuit. Starting now, really. This is where the pulmonary circuit starts, from the right ventricle into the pulmonary trunk. Now there's a valve right here between the right ventricle and the pulmonary trunk, very important. These valves now are not AV valves anymore. Remember, the bicuspid and tricuspid were atrioventricular valves. The blood was coming, leaving the heart. I'm sorry, not leaving the heart. It's going from the upper to the lower chambers. But now there's blood coming from the right ventricle into the pulmonary trunk. It's leaving the heart. So this is one of the two semilunar outflow valves. And this one happens to be called the pulmonary or pulmonic valve. Notice it doesn't have all this chordate tendon A and all these parts to it, which I'll show you later. So the first valve we're meeting that's preventing backflow from the heart is called the pulmonary valve or pulmonic valve. And this is a semilunar outflow. So for now, I think it's good that you separate the functions of the valves. Like if you're talking about the tricuspid valve, you would say the AV valve, tricuspid AV valve, atrioventricular. But if you're talking about the pulmonary valve, I like to call it a semilunar outflow valve. So like when you're doing your homework or you're doing your practice work in your lab Word document, you should put in pulmonary semilunar outflow valve, because you know it's an outflow valve and it's different physiological and anatomical from the AV valves. That's the point of that. So over here on the left side, you have the left ventricle is going to pump blood into the largest artery in the body, and that's called the aorta, right here. So there's a valve between the left ventricle, which is a chamber filled with oxygenated blood, and the valve is between the ventricle and the aorta. And this is called the aortic semilunar outflow valve. Everybody with me? So you met 4 valves, 4 chambers, 4 valves, right side, left side, upper and lower. So you really only have to remember 4 valves. The 2 AV valves prevent backflow within the heart, the right-sided tricuspid, the left-sided bicuspid. Then you have the outflow valves, where the right ventricle is pumping blood into the pulmonary trunk, and that's the pulmonary semilunar outflow valve, preventing backflow into the right ventricle. On the left side, you have the aortic semilunar outflow valve, which is preventing backflow into the left ventricle, and it's between the aorta and the left ventricle. So now, without showing you the picture, if you have a good memory, like short-term memory, like which of those 2 chambers, like the muscle walls, now we have to think anatomy a little bit, not just the space in the chambers, which walls were thicker, the left ventricle walls or the right ventricular walls, as far as myocardium went? Just think about it. The left, it was a lot bigger. Now, why do you think? Who's got the smarty pants on right now? And this is evolution, and for years, and of course, when you're born, it's the same thing, even now. So why is the left ventricular myocardium so much thicker than the right ventricular myocardium?
Is it because it has to pump it farther?
Yeah.
It's got to pump it against the whole body and all the pressure
gravity.
that your arteries have. Do you ever hear blood pressure? You ever hear that? Like blood pressure, you know, when the guy or the gal puts that cuff on your arm and sees how much pressure that the arteries are exerting against that cuff. Well, that's a constant thing. You constantly have blood pressure, or else you'd be bellying up all the time, because you have to get blood to your brain quickly, you know, or else you're going to fall down. You have just a lack of blood pressure. If your blood pressure goes too low, you're gonna have syncope, which is a dizziness, and you're going to go down. So really, this all starts with the left ventricle as a pump start, but the arteries themselves have, what kind of muscle do they have again? Did I tell you before? Was it skeletal smooth or cardiac muscle within the arteries?
Smooth?
It's smooth, and that needs nervous system innervation, impulse. So the nervous system keeps your blood pressure, along with hormones, keeps the blood pressure maintained. So what's a normal blood pressure? Like systolic over diastolic. What's like that average for the country?
120 over 80
It
or
is. I don't
110
know.
over
It's a little high
70.
though, don't you think, Louisa, the 80? But it's 120 over 80. That's correct. So your arteries have their own pressure due to that smooth muscle. So the left ventricle, not only like does it have to, and you were correct when you said that the left ventricle has to pump a further distance to distribute those arteries, but that would never happen with just the heart. You have to have blood pressure within the vessels to the arteries to get the blood to all those tissues, including that stupid, ugly pinky toe that I have, right? Not only your brain is easy because it's right there, right? It's right above the aorta. So the left ventricle has more work to do. Do we all agree? It's got this afterload it's got to press against. And that's why over time, evolution-wise, the left ventricle is much thicker. And the chamber appears larger than the right ventricle, even when you look at a dissection, which I'll show you. So that's really important. Everybody clear with that? So this is important physiology. The anatomy you'll learn, you'll just keep going over it, right? So the aorta now is carrying the oxygenated blood right here. And it's eventually is going to go into what's called the aortic arch, because some blood needs, of course, to go up to the arms and the brain and the head. And the rest of the blood has to continue down, like right here, it shows you the descending aorta, which takes blood down through the thoracic area into the pelvic and the legs. So this continues. But this is very important. Everybody listening right now, because this is an extremely important thing. It's a question on the quiz probably, and it's definitely a question on the exam. So if you're listening, please. Now, once the blood is pumped through the aortic semilunar outflow valve, we have two openings. It doesn't even show you on half of these pictures. There's two openings just above the valve. Are you with me? Now, this is the first branch of arteries that come off of the aorta, above the aortic semilunar valve. And these are your left and right coronary arteries. And what do coronary arteries do? They feed oxygenated blood to the heart muscle itself, everywhere, atrium, ventricles, but especially right here. Like, look how thick this is right here, that left lateral wall of the left ventricle. So a lot of action potentials in this muscle, and that's what's helped squeezing. So that's important. And then I think you have to know these three too. Like this aortic arch has three branches, and the most medial, or the one most to the right, is called the brachiocephalic trunk. I don't really like artery. I like trunk better, even though it is an artery. But I like to call it the brachiocephalic trunk. You have to memorize these, and your homework will do a good job helping you with that. Now this one right here is the left common carotid artery. And you have to say it that whole way. You have to say left common carotid, not internal or external carotid. You have to say common carotid. And of course, you have to say artery. And then over here, you have what's called the left subclavian artery. And subclavian means below the clavicle. But in this class, we really don't go into the anatomy of the arteries and veins, so to speak. We stay to the heart. So later on, you'll see the branches of the left and right coronary artery, of course, and then these three. And notice this is just the left common carotid artery. It's not right. And this is the left subclavian artery. Now the brachiocephalic trunk is going to branch to the right common carotid artery and the right subclavian artery. And there's also an artery called the vertebral artery, which is a branch off of the two subclavians, left and right. So it's a little asymmetry in this evolution, don't you agree? Like, it's like weird. Why is that just that whole vessel just for the left common carotid, right? That whole branch. And then this is just for the left subclavian artery. And this one is just brachiocephalic trunk. So you just got to memorize those for now. And you'll understand more how it works if there's an aneurysm or atherosclerosis, anything that could happen, especially again, because this blood these are arteries. So they're taking oxygenated blood away from the heart, and the left common carotid is feeding ultimately the left side of the brain and face, of course, too. So the common carotids are bringing in some blood to oxygenate the neurons of the brain. Here's a model. And again, on the exam, I could use a model like this. So get to know these. And this is showing you the four valves, right? You have your tricuspid valve. And then there's bicuspid, also known as mitral. See, this is the pulmonary trunk. So this is the pulmonary semilunar outflow valve. And this is the aortic semilunar outflow valve, which you can't see, but it goes behind. Like the pulmonary trunk is anterior to the aorta. That's kind of important too when you're looking at a dissection. Pulmonary trunk is anterior to the aorta. And it's good that these are colored. And remember, this is a vein here. These are pulmonary, this red vessel right here. It's probably on the exam. These are pulmonary veins. If this is the left pulmonary veins, and this is the right pulmonary artery, and because that's pulmonary circuit. This is an old remnant of an actual patent tube. Like there's not supposed to be oxygenated and deoxygenated blood mixing here. So in a fetus, before you're born, this is a duct. It's called the ductus arteriosum, which has blood mixing because fetuses, they don't use their own lungs until they're born. They're getting their oxygen from placental blood from their mom. But once you're born, this duct becomes inactive and it becomes a ligament. So we call it the ligamentum arteriosum. Just so you know that. Like here's your SVC, superior vena cava. That's that blue vessel. Here's your right atrium. And you notice that, and again, this is not a great picture to show you, but you could see the myocardium is the muscle, right? And then you have your chamber. And I also forgot to mention before, but this structure right here, this big piece of myocardium that separates the two ventricles, and get the spelling here because it's called interventricular septum. A lot of muscle in there, and there's a lot of nerve tissue as far as that automaticity goes. So look, it says inter, I-N-T-E-R. That means between. There's a question on the exams that says, it might just be point out the structure, identify the structure, and you'll say interventricular septum. But some people would intra. Intra means within. So be careful with that. This is a posterior view of the heart. And again, get used to that. And you're going to do that with your homework. You'll have good practice. So I like this part right here. Like right here is where the coronary blood, deoxygenated coronary blood is entering the right ventricle. I'm sorry, right atrium. And right here you have a structure which pretty much all the blood, deoxygenated blood drains into before it goes into the right atrium. And that's called the coronary sinus. Remember, it's posterior. Now, sinus is just like a large vessel, and veins are larger. And you'll see the anatomy later. So the coronary sinus, again, remember, it's a vein, and it's draining blood from the coronary circuit into the right atrium. And this is where it comes in. So these vessels, red and blue, that you see here are all coronary vessels. Like later on, you'll see this big red artery is the posterior descending artery, which is a coronary artery. It's feeding the back of the heart pretty much, and it branches around. Like, next picture, hopefully I'll show you more. So again, know this is posterior. Know this is your left atrium right here, right? This is your left atrium. So these are your pulmonary veins, which is important to know. And this right here is your IVC, your inferior vena cava, because this is the right atrium, right? And here's the aorta, right? As it starts to descend, it'll go down behind the heart. So later on, you'll see, and again, in your homework, you'll be able to label the important coronary vessels and the great vessels. When I say great vessels, I'm talking about the aorta, the superior and inferior vena cava, and your pulmonary trunk. Those are the great vessels and some of the branches that we went over. So by the time you get to the first exam, you should be able to draw this out yourself. It's really not difficult once you do it, but I recommend that you do this just so you have everything. And you can see the aorta, the branches, all the valves, because it's really only 4 valves, only 4 chambers, right? This is a sheep heart. So again, if we were in lab, we'd be going over the sheep heart and we'd be dissecting it ourselves. So I kind of like this because like this is an anterior view here of the heart. So is this down here. But anybody know what's that big muscle that's right below the heart and lungs? It's a skeletal muscle mostly. It helps us breathe when it contracts and then it relaxes on expiration. What's that big dome-like muscle called?
Diaphragm.
Yeah, the diaphragm. So the heart kind of sits in the real body because again we're bipeds, right? the sheep is a quadruped, so it's a little different. But our heart should lay kind of on the right ventricles, kind of laying on the diaphragm, and this part of the heart, the very tip of the heart, which is inferior, is called the apex. So the apex of the heart is really the bottom left part. So the apex really is owned mostly by the left ventricle. Like the top of the heart, which is kind of weird, is called the base when you're looking at the anatomy. So your apex of your heart kind of goes off to the left. You understand that? It goes off to the left, maybe between the 5th and 6th rib, right under your underarm, more or less. Does that make sense to everybody? Yeah. So this is like more if we were holding the heart, like it'd be upright, but it's not like that. It's more oblong, more across the diaphragm like that. And you have a sulcus, like this is where some big coronary arteries are. And it's kind of oblique in the anterior view. And this is not the septum, but we call it interventricular sulcus. Sulcus is like a groove that usually houses like some arteries running through it. It's not a hole, it's just like a little valley. So it makes sense that's interventricular, meaning it's between the two ventricles, the right ventricle and the left ventricle. Now, notice up here, it says auricle, like left and right auricle. Now, this is just part of the atrium or atria. To say atrium, plural, you say atria. So auricle is just an appendage on the atria that gives it more volume, right, as blood's coming in. So if I pointed that out on an exam and you said right auricle or you said right atrium or left atrium, left auricle, you'd be 100% correct, you understand? And there is some adipose on the heart. Again, it's hard to see. Now, this is a posterior view of the sheep heart. This is a sheep. I think we would have done pig. And again, I probably will do a dissection for you once we get into the lab. And so at least you get to feel it, put some gloves on and feel how thick this is and how hard it is to cut through this myocardium. So this is a more horizontal interventricular sulcus, and this is posterior. So you can see the IVC. Now it's a little harder when you're not looking at models. So again, we're gonna have to look at this in lab, I think, to help you out. These are, again, from the left side. So this is pulmonary veins going into the left atrium. This is showing a piece of the pulmonary trunk. And here's the aorta. Remember, the aorta is, and I'll show you later, an artery, like the aorta is the largest artery in the body, is very elastic. So it's not as muscular as your distributing arteries, but it's pretty large and has a pretty thick middle layer of muscle, which you're going to learn is called the tunica media. Always remember the layer of arteries and veins. Media is middle, and it's smooth muscle every time, and arteries and veins. But the arteries are generally more circular and have thicker tunica medias, thicker smooth muscle, as opposed to the veins, like a pulmonary trunk, even though technically that pulmonary trunk is an artery by definition. But it's still just going between the heart and the lungs. So most veins in the systemic circuit now have very thin tunica medias. So the pulmonary trunk may be a little bit of an exception. But you can, once you feel the heart, you'll see the difference between the two, is my point. And this would be the superior vena cava. And you can, again, we're just looking at pictures, which is completely unfair. But you can stick your finger in there and you can, all of a sudden, next thing you know, you're in the right atrium. And same thing with the inferior vena cava. And you have all the same parts, like this is the left ventricle right here. This is the chamber. And here's the myocardium. This is the interventricular septum. Look how thick that is. So the interventricular septum really belongs more to the left ventricle. And look how small the right ventricle is compared to the left. That's a big thing. And you will see that a lot. And this is the left atrium here. This is an auricle. But now this is what I need you to see. Let me see if we can see it on the next page. This is just showing you different angle, like superior angle of the heart, a close-up of the auricle. The heart comes with a sac, like it has a connective tissue sac, which is the outer covering, which you'll see is called the pericardium, or the fibrous pericardium. I just write that down for you in this recording. That's the fibrous pericardium. And you're going to learn this if you haven't already in the 3 layers of the heart: the fibrous pericardium, the endocardium, and the epicardium, which is really the visceral pericardium. And there's a space between the visceral pericardium, which is also known as the epicardium, and the fibrous pericardium, and that contains fluid. So this is dense connective tissue. Again, I think you need a visual in lab, so I will definitely show you that. This is not the fibrous pericardium. This is the visceral pericardium, also known as the epicardium. And you need a tweezer. It's so thin. Because now we're dealing with a little bit more epithelial tissue, not all connective tissue. And there's a space between the epicardium and the fibrous pericardium. So there's another close-up. So here's what I want to show you. Now this, again, this is turned around where, now always, let me just get in your face for a second, because this is kind of important. We're not doing dissections, obviously, because we're here at home in our pajamas, but when you look at anatomy, just in case you don't remember this, there's a lot of smarty pantses in here, but like when you're looking at a picture of anatomy or a patient or your schoolmate or a dissection, you know, you don't own the anatomy, the subject owns the anatomy. So your right is their left. Everybody understand that? But in this case, with this picture, which could be confusing, is that heart has been turned around. Like we cut it in a frontal section and we opened it like a book. So all bets are off now. You understand what I'm saying? Like I can't tell what's right or left because you could have turned it upside down, Finzio. It's not a practical exam, it'll be a picture, right? You kind of understand what I mean? So let's go back to the picture. And if let's say I just put this on the table now, and then I asked you, now look, everything's turned around here. I'll give you a little hint. It's not normal, what you're normally looking at. So what chamber is this right here? Everybody see what I'm circling? What chamber is this? Say again?
Right ventricle,
That's the right ventricle. And why'd you say that?
because it's smaller than the left
Yeah, I
ventricle.
agree. I'm with you. I'm with you on that. Good job. And look at the walls right here. Look how thick this is, that left lateral wall to the apex that's between the 5th and 6th intercostal space, the left side of your body. And this is thinner. You see that? Very good. Now, based on what we're talking about here, what is this valve right here?
The AV valve.
It's an AV valve. Excellent.
Yes. Okay.
And this is the left side. So that's the bicuspid valve.
Bicuspid, yeah.
Okay, you got it. Excellent. And notice that the AV valves have like cusps. Then they have, you're going to see again in other pictures, they have like these heartstrings, which is connective tissue. And that's called, I don't know if I'm spelling this right, chordae tendinae. Chordae tendinae. And they're like heartstrings, and they attach the valve to the myocardium. And this is not a great picture of it, but the chordae tendinae are attached to smooth muscle structures called papillary muscles. Everybody with me? I'll show you a better picture of it. But get this, the semilunar outflow valves don't have chordae tendinae or papillary muscles. Got it? But AV valves do. And that's my point, because there's a question on the exam about that. And you can clearly see the chordae tendinae, so it has to be an AV valve. Like this one right here, like what chamber, this is if I cut the heart from the top and you're looking down at it. So what chamber would this be? This thick muscle here, left or right ventricle?
The left.
Yeah, you got it, because it's so much thicker. Let's face it, you know, like the right side of the heart is thick too. It does a lot of work. So that's more like Kanye West, right? You know, but the left side of the heart, that's Jimi Hendrix. That's the rock star of the heart. That's doing a lot of work. Like you told me before, against pressure, the whole body, long distances. I like Kanye West. I'm just saying Jimi Hendrix is more of a rock star. You know what I mean? So now a semilunar valve, this is not a great picture of it, does not have chordae tendinae. So this is a terrible picture. Let me show you a close up. I think it's a really good picture there. Like this is a valve. Of course, I'm not going to make you look at this picture and you have to tell me everything about it. But this is a semilunar outflow valve. semilunar outflow. It happens to be the aortic valve. And the only reason I know this is because here's the opening for the left and right coronary arteries. And where did I say that was? Above the valve off of the aorta. Everybody with me? And here's the cusps. You don't have to count cusps. Don't ever count cusps. You'll get lost. Here's the cusps that prevent the backflow. They have to close, right? They have to close to keep blood flowing in the right direction. It shouldn't be going back into the left ventricle, because you told me that the function of a valve is to prevent backflow, which is regurgitation. So you always want to have anterior grade or anterograde movement of blood. And it's a one circuit. It's a one direction circuit. Everybody okay with that? It's closed circuit because it's not like the respiratory system where you're breathing in through your mouth, or your urinary system where you're peeing out your urethra, or your digestive system, which have two openings, mouth and anus. This is a closed system that runs one direction. Are you with me? That is really important. It's very simple, but it's really important. And this has to happen in time, under the right pressure, the 120/80, under 100 beats per minute heart rate at rest. It has to be able to recover when you exercise, and all at the same time has to get oxygenated blood to every tissue in your body, especially your brain, and also that stupid, ugly, crusted little pinky toe, right? Because that has cells too. So everybody with me? How this one direction has to happen. Okay. So 4 valves preventing that backflow. So now let's just jump ahead a little bit just to see where we're going with this ultimately in 3 weeks. Let's say the heart has a rhythm, first of all. We're going to go over this many times, but the heart has a rhythm, and the normal heart rate, and this is on the quiz, I believe, so I might as well give you the answer since you were so patient with me today. The normal heart rate at rest, right, at rest, is 60 to 100 beats per minute. At rest, sitting down with your legs on the floor would be best. Everybody with me? So that heart rate has 2 sounds, right? Lub-dub, 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 lub-dub. So a lub-dub is 1 heartbeat. Everybody good? So you could have 60 to 100 of those per minute. And the valves have to close at the right time, and then they have to open for, filling of the ventricles is really important. You're going to see. Everybody cool with that? So think about how this has to happen. You have to get all the blood at the same time into the atria, right and left. Then the valves, of course, have to be closed. Which valves have to be closed, by the way, when the atria are filling?
The AV valve.
God damn right it is. The AV valves have to be closed because you need that pressure to build up. Because without that volume and pressure, you hear what I'm saying? Volume, pressure, has to build up in the atria before the valves can open. And then the ventricles have to fill. And that's a big job, don't you agree? You really have to fill those ventricles correctly at the same time. So then the ventricles fill. And once the and listen to this, when the ventricles are filled, what valves have to be closed?
The semilunar valves.
Yeah, man. Yeah. So the semilunar valves are closed. And then the pressure that builds up in the ventricles from that filling allows the semilunar valves to open, and it ejects the blood into the lungs from the pulmonary, from the right ventricle, into the aorta from the left ventricle. Sorry, I'm using the wrong hands. You understand that? So there's a circuit, and it's a cardiac cycle. The timing has to be perfect every time. I don't know how that happens, but it has something to do with the autorhythmicity, the health of the heart, how much blood fills the ventricles in that minute, and the health of the valves. Everybody cool with this? A lot of stuff can go wrong. You understand? So again, while we're on the subject, we'll tackle a lot of things while we're here. What is the main pacemaker of the heart? Anybody ever hear this? Like, what is the first place that every rhythm should start? Every lub-dub should start from? The SA, the sinoatrial node, right? The SA node, and that's located in the superior lateral right atrium. That's where it is. I didn't make this up. This is what they told me. This is where it is for millions of years. Who knows? It could have been on the left side when I was 130 years ago, whatever, when I was in kindergarten. So it has to start at the sinoatrial node, the SA node. And that's why if it's within 60 to 100 beats per minute, right, and the EKG looks regular, then we can call it sinus rhythm. Then you move on to something else. You go have lunch as a nurse, you go to the nurse's station, you have some water, you go out and smoke a joint, whatever you're going to do. But it has to be good with sinus rhythm because it's coming from the sinoatrial node. And just to give you a heads up on the EKG, that's a really sexy P wave and a good timing between the P wave and the QRS, which is the ventricular depolarization. So the atria depolarize first, starting with the SA node. And what does depolarization mean? Anybody know that? Let's just talk about it. This is a review, right?
Contraction?
No, good answer, but no. What is depolarization? Now, first, contraction is, let me just tell you real quick again. When the heart contracts, like it contracts separately. The atria are going to contract first, and then the ventricle is going to contract second. So the atria have to depolarize first because that's where the kick comes from the atria. So in order for those muscles, remember I told you that the skeletal, the smooth muscle is not that smart. So it needs to have electrical impulse to shorten and contract. So the SA node provides action potentials, but without action potential, you can't get an action potential without depolarization. What does that mean? This is crazy, right?
So the charge becomes more positive?
Yeah, man. Yeah. Well, I'm liking this. Yeah. Yeah. The inside of the cell membrane becomes positively charged because at rest, a muscle cell is negatively charged inside for that moment, split second. But now you depolarized it. And that happened because of the SA node. Holy shit. And what's the ion that really makes things positive? What's that? Na plus. What is that called?
Sodium.
Yes, sodium. It used to be called natrium. Again, back when I was in kindergarten, back in 1900 or whatever, it used to be called natrium. That's why it's Na. So sodium rushes into the cell and causes excitation, action potential, and then those stupid muscles can shorten and contract. And then you get atrial contraction. And that's also known as systole, atrial systole. Systole goes along with contraction. Diastole is when it's relaxing. So on repolarization, when you stop the depolarization, the sodium stops coming in and the potassium leaves. Again, it's not my responsibility to teach you that. You're gonna have to learn that in lecture, but I'm just giving you a heads up because it's important for your EKG because that's what we're measuring with EKG. That's it. We're measuring the sodium coming into the cell and it shows off on these skin electrodes. And then it comes out on a little piece of paper with little waves, positive or negative, which is very complicated when we get there as far as what you're looking at. So the SA node has to stop that to have normal sinus rhythm. Everybody good? Does that make sense? And the SA node starts that. By the way, I mentioned lub-dub, right? Lub-dub, two sounds. So you're not on an exam, please don't write lub or dub because then I'll just laugh at it, but I have to mark it wrong. So lub, the first sound is called S1. The second sound, the dub, is called S2. So you got to use S1 and S2, please. Again, you try doing that on NCLEX, but dub. So the first sound, get this, the first sound happens after the ventricles are completely filled. So what valves close after the ventricles fill?
AV valve.
Yeah, man. So that the AV valve slam closed, and that's your lub. So the lub, S1, is closure of the AV valves, tricuspid and bicuspid. So then so much pressure builds up in the ventricles. And by now remember our old friend, the SA node? The conduction has reached the ventricular myocardium now with these Purkinje fibers, you'll see. And then we have ventricular systole, which is a rock and roll Jimi Hendrix, on one side, of course, the Kanye West on the other side, but who cares? So then you have ejection of the blood, right? Out of the left ventricle into the aorta. And let's face it, we're really talking about the left side mostly. So the blood is ejected against all that pressure from the arteries into the aorta. Through what valve, by the way? What valve is between the aorta and the left ventricle?
Pulmonary valve.
Yeah.
No, the semilunar valve.
Which one?
The aortic valve.
Yeah. But you know what you should be answering? Right? Very good, Nora. Thank you. But you should be saying, listen, Finizio, it's called the aortic semilunar outflow valve. Okay, very good. So the blood is ejected, and of course, like you said, the pulmonary valve is open and it's ejecting blood into the pulmonary trunk at the same time, right? I don't care, Kanye West and Jimi Hendrix at this point. So now, once the blood is ejected, what's going to happen to the semilunar outflow valves?
They're
It
gonna stand
closes.
They're
shut.
going to close. They have to close because if they don't close, you're going to have regurgitation, right? Very good. So now that makes a sound too. So the S2, the dub, is closure of your semilunar outflow valves. And it's the timing for this, man. It's like, if you like what's the average heart rate of the United States? 70, 75 beats per minute? Let's say 75 beats per minute at rest. At rest, remember, it's not a cardiac stress test. So based on that cardiac cycle from the SA node to the closure of the semilunar outflow valve should take about 0.8 seconds. And you'll learn that in lecture. You'll learn all the different parts of this cardiac cycle and depolarization and repolarization and all of that. And the action potentials of your pacemaker cells versus your cardiomyocytes. So does that all make sense? How this heart works? All right, let's go back to this PowerPoint. We have to share that, right? It's not shared right now. So again, I just can't stress this enough. This is the aorta here. This is part of the aorta up here. And here's the valve down here. So again, the first branch is the left and right coronary arteries. The blood is pumped into these holes to the vessels that feed the myocardium of the heart oxygenated blood. So they're arteries. This is just showing what could happen. Like, these are great pictures of the openings, aren't they? This is the aortic semilunar outflow valve here. And here's the cusps that close. Like, let me give you a visual again. I sorry to keep stopping this, but I'll do a recording if we miss anything. So did you ever go outside like with an umbrella, right? When it's raining, you use an umbrella, you know an umbrella, right? Like Mary Poppins. And you go outside and it kind of forms a dome, right? So that's pretty much how it works. Like, and I'm also including the AV valves here, because the AV valves need those chordae tendinate and papillary muscles to suspend it to the myocardium. But let's say it gets really windy when you went outside with your umbrella. What happens to the umbrella if it's really windy? Did you ever notice this happen?
Bends backwards.
It goes up inside out, right? Yeah. And that happens to a valve if you have an insufficient, especially an AV valve, like the mitral valve, the bicuspid valve. And that's called a prolapse. So the blood is going to come back in because you have room on the sides, you understand? So that could happen. So now going back to this picture, like what could happen here? I just can, again, it's important that we talk about this. Now, this is a buildup of, it could be cholesterol, it could be bacteria, it could be other fatty atheromas, like fibrin, which is like a clotting factor. It could all build up right here over time. Now, remember I said that basically the atria and the ventricles are separate chambers electrically too. And they're kind of insulated with connective tissue. Like the heart has a fibrous skeleton. Are you kind of following me? Like that's not muscle. Like I'm talking about the parts of the heart that's not muscle. So like, you ever pass by a building that's being built? You know, you see the frame and then they fill in all the bricks and inner walls. You follow me there? Well, the heart has a fibrous skeleton that's connective tissue. And connective tissue, and the valves are made of this too, are non-conductive, meaning that you can't get nerve impulses through them. Muscle is very conductive. That's why the heart's made of muscle, so it can depolarize and contract. Are you with me on that? So the fibrous skeleton provides an insulation for the impulses coming from the SA node all the way to the ventricles. So it has to be compartmentalized. You understand? And you'll learn more about that. I know I'm going ahead a little bit there, but I think it's important when you're learning the structure of the heart that you keep these things in mind for going deeper into the semester. So sometimes the atria will fire too many action potentials, right? Too many action potentials. So if that happens, you can't really get a good ventricular heart rate. So let me just ask you this. You might know this one too. This is a little different. Like the SA node starts the pace of the heart. It's the main pacemaker of the heart. Everybody agree? Just shake your head. Yeah, yeah. That is the main pacemaker. And it's the fastest pacemaker. So then the atrial cells themselves can also elicit action potential. So they're also orthorhythmic, the atrial muscle cells themselves. So sometimes the atrial muscle cells depolarize too much. And I'm not talking about, somebody snorting at cocaine or just normal, in a normal heart. So the atrial cells sometimes over elicit action potentials. Are you with me? But all right, let me just get to the point. Did you ever hear of atrial fibrillation? You probably heard of it. You probably saw it in a commercial. Maybe you're watching Grey's Anatomy. Maybe your brother or your dog has it. So atrial fibrillation is way too many action potentials in the atria. Louisa, you okay? So that has to be controlled because let's face it, the ultimate outcome of this cardiac cycle is to get a good left ventricular ejection into the aorta. So how could let's say you have atrial fibrillation, right? Which your atria is putting out 300 action potentials per minute, atrial, but your ventricular heart rate is 80 beats per minute. How could that happen? There's another pacemaker in the heart that slows everything down. Anybody know what that's called? And it's between the atria and the ventricle, towards the middle of the heart.
AV.
The AV node. So the AV node is a slower pacemaker, controls what gets into the ventricular muscle cells electrically. And that's, it's surrounded by connective tissue too, which helps insulate that. So even if your atrial rate goes haywire, the AV node is going to save the day and create a normal resting heart rate. But you have to have an EKG, or else you don't know you have atrial fibrillation, right? Or you wear a little Fitbit, or you wear your Apple Watch or whatever, and it tells you you're in atrial fibrillation. Oh shit! I didn't even know. I felt fine. I felt a little dizzy when I was, ice skating, but So the AV node saves the day. So the ventricular action potentials are normalized. You kind of following this the way this works, but it all starts with the SA node. So in a case like this, like say you have atrial fibrillation, you don't know it, but you have all of this bacteria building up, right? In here, or even worse, you have clots, like fibrin clots. And they will get there, especially, and you don't even have to have a clot anywhere else. Now, what if this clot, say there's a clot, like a big chunk of this shit goes into this hole? Are you with me? Are you with me? Anybody? I guess I'll have to get your
Yes.
face. So let's say that clot, I shouldn't even call it a clot. Let's just call it an atheroma, which is kind of like part of a clot. Say that piece of that goes into the holes, which we now should know are the openings for the coronary arteries, which are the arteries are coming from the heart and they're delivering oxygenated blood to the muscle itself. Let's say to the left lateral wall, the left ventricle. What's going to happen to that heart muscle if that clot gets into one of those arteries?
It may cause ischemia.
Oh, hell yes. Yeah, it's going to cause lack of blood flow, ischemia to that cardiac muscle. And when you have no oxygen, because it's oxygenated blood, that's what ischemia means, low oxygen. It's not even just blood, it's oxygen. What's going to happen to that muscle cell?
It's going to die.
It's going to get injured first. It might not die right away, but it's going to get injured because it can't contract and you can't depolarize membranes because you don't have the ATP to do it in that particular part of the heart. So it'll stop working and start breaking down a little bit. And you can do blood tests, you can do blood markers to see if you have some enzymes that are in your blood. But ultimately, it could lead to death of the cell, which is called what? What do you call that in the heart or any tissue, really?
Necrosis.
Necrosis, but there's another word even before that. Begins with an N, ends with a farction. Infarction, right? You have an injury and then you have infarction, which leads to necrosis, yes. But this happens so sudden. I mean, if you don't have oxygen in that, especially the left lateral ventricle, you're not going to be able, Jimi Hendrix, you're not going to be able to pump blood correctly. And it's going to affect your cardiac output, which you'll learn. So, but it's going to show on the EKG because you're going to have problems depolarizing those muscle cells. So the sodium is not going to be able to get in there as correctly. You understand? So ischemia, maybe from a clot in this case, or vasospasm, anything, can ultimately cause a myocardial infarction. And what's the colloquial term for myocardial infarction? Like, what's the common words? It's a heart attack, right? Heart attack, so infarcted cells because of ischemia and infarction. Any questions about that? So AFib can actually cause something like that, but it doesn't always go into those holes. Sometimes it'll continue into the carotids and cause a stroke, right? That's more common in something with AFib, just to give you an example. Like the clot will make it past those holes, past the coronary vessels, but ultimately we go into the brain vessels. And lack ischemia in the brain or infarction of brain cells is a stroke, a cerebrovascular accident. So here's an AV valve because it has the chordae tendineae. And the papillary, remember the papillary muscle is a smooth muscle. I think I asked that on a quiz too. That's smooth muscle. That's not cardiac. And then, like again, it doesn't show it so great here, but any like inner, like the myocardium, not the layer, but the actual tissue is called trabecula carne. It's like trabeculated meat. It's just the way it looks, basically. And you'll see on the models, like all this is the trabecula carne in here, just a part of the myocardium. This is a papillary muscle. This is the chordae tendineae, and these are the cusps or the AV valve. So the answer to this is AV valve, right? AV valve. Why is it AV valve? Because it has chordae tendineae and papillary muscles, where the semilunar outflow valves don't have that. And it works on pressure. Anybody know what type of tissue this is? Oh, it's muscle, but what type of muscle is this of the three? And this is going to be part of next week's quiz. So again, if I don't get to it, I'll give you all the answers on the recording for the quiz. So anybody, what is this? What type of muscle is this? Cardiac, smooth, or skeletal?
Cardiac.
Yeah, this is cardiac, right? And here's an intercalated disc. It's striated, right? It's striated. Is it voluntary or involuntary?
Involuntary.
Yeah, they're all involuntary except for skeletal. And it kind of looks like skeletal in a way, but it's usually centrally located one nuclei per cell. Like these are the cells, these lines of proteins, which if you remember, are actin and myosin. Cardiac muscle is generally branched, and it has these intercalated discs, which are connective tissue tubes that contain the gap junctions between the cardio muscle cells, or cardiomyocytes is another way to say it. So all of this is nuclei, these dark staining nuclei of the muscle cell, cardiac muscle cell. So this is cardiac muscle cell. Here's an intercalated disc. And you'll see in between a lot of this, you have, this is Purkinje. Purkinje, so I think I'll spell it right for you, with a J at the end, Purkinge. These are conductive, non-contractile cells in here, all this white stuff. So Purkinje cells is a continuation of the conduction system. Remember, I'll just give you, we're going to do this again, but the conduction system starts with the sinoatrial node, SA node, then goes to the atrial cells across to the left side of the heart. And then the AV node, atrioventricular node, which is also called junctional node, will continue that conduction into the ventricles. Remember the interventricular septum, that contains an area called the AV bundle, also known as the bundle of His, and that will branch down the interventricular septum for the left and right bundle branches. And ultimately, the bundle branches will give rise to the Purkinje fibers, which innervate and allow all the myocardium, the ventricles to contract, just so you know where that's going. So this is, I think on the first quiz, you're going to see these three. And the top one is skeletal muscle. Skeletal muscle is also striated. It's the only voluntary one. Striations are those bands of actin and myosin, mostly myosin, because that's the thick filaments. And then you have multinucleated. Remember, cardiac muscles usually only one nucleus per cell, but skeletal muscle is multinucleated, and the nucleus is usually always in the periphery of the cell. Like this is the cell longitudinal view, the striations. Where in cardiac muscle, the nuclei is usually centrally located, but they're both striated, and the only voluntary muscle is skeletal muscle. Anything else? The big thing is the hallmark or the intercalated discs. These are white stuff here is the Purkinje cells, and everything else is myocardiac muscle, striated, intercalated discs. Yeah, this is a good histology there. And this is smooth, which means it has no striations. The cells are more spindle shaped, and the nucleus is more spindle shaped too. And of course, it's involuntary, like cardiac muscle and smooth muscle. Smooth muscle is also known as visceral muscle, are both non-striated. That's probably why they call it smooth. And that's about it. So get a good look at these three, and I'll put it on the quiz. I'll probably put this as one of the first two questions. You just know which one's voluntary, striated, and know what they look like. Like skeletal muscle is very linear in its configuration with peripheral multinucleated. The cardiac muscle, which is down here, bottom right, this is cardiac. This has branching single nucleated fibers with intercalated discs. The smooth muscle, no striations, and it has a centrally located nucleus that's usually spindle shaped. And of course, it's involuntary. Anybody have questions on that? Yeah, you really need to know this for the first quiz, I believe. You know, this is important. So what type of tissue is this? Which muscle is this? Look close.
Cardiac.
Yeah, that's cardiac. I see the intercalated disc first, but that's just me. You know, again, everybody's different. You notice that it's branching too. It's striated, it has a single nucleus for the most part. Yeah, here's a close-up of a cardiac muscle nuclei and the striations. Myosin is the thick one. This is a tough thing. I would never ask you this, but this is just a cross-section of the ventricle, just to show you, the difference. This is a good picture. Even though, notice, just be careful if you see this on the exam, like the intercalated discs are not staining dark. So just take a look at this histology, so you can recognize that. And these are Purkinje, these wider cytoplasm cells. This is a tough one. Again, this is a cross section. I would never ask you. This is a good one. Just to get a look at the difference between the contractile cells, which is muscle. It's cardiac muscle, right? Contains actin and myosin. And in lecture, you'll learn about calcium and the muscle contraction. It's very similar if you remember skeletal muscle contraction in general A&P. And here's Purkinje fibers, like I told you. And it's a close-up of the Purkinje. And this is a tough one, but you can see this is the contractile muscle. Notice the nuclei. And this is not contractile cells. These are non-contractile conductive cells, though, because that's part of the conduction system of the heart. This is a vessel, blood vessel, and it happens to be one of the coronary vessels. So this is not a good picture as far as health, because you should know what the word lumen means, right? The lumen is the space. Now this is a clot right here. This big red thing is a clot. Sorry, I'm using red right here. That is a clot. So this is a pathology. And there's different layers. Like this could be even a carotid. Like this is the middle layer, which is mostly muscle. It's called the tunica media. Like, let me see if I got another picture here. Like right here, this is better. You have the lumen of the cell, which is up here. The lumen is the space where the blood travels. It's like the empty part of the hose, in a hose where the water runs, but there's normally blood cells in there, of course. So you have the tunica intima, which is this layer, just this top layer, and that's epithelial tissue. And then the tunica media is all this thick, smooth muscle. Now, this is all just dense irregular connective tissue, or it's areolar connective tissue, sorry. So this is the tunica adventitia right here, this layer, not this. And this is also called the tunica externa. And this is more for anchoring to other structures like bone and muscle or other organs. So tunica media is the one you should really know the most when you're learning your blood vessels in lecture, because that's mostly what? Smooth or visceral muscle. Okay, and here's a good one to practice. Like here's a lumen. Always find the lumen first, and you can see the tunica intima, or it's also called the tunica interna. This is all tunica media, all of this out here. And just this is the tunica externa. And this is other connective tissue between other tissues, like I said, like bone. Now notice this is blood cells right here within, like say, the aorta and the tunica intima. And if you remember the elastic fibers that are in there as well, especially in the aorta, because that's where all the blood is being pumped first. And this is all tunica media here, which is smooth muscle. And this is externa. This is another vessel, which is probably a vein, because the vein has much thinner tunica media than does arteries. This is much thicker, right? That's an artery, because look how thick that tunica media is. These are blood cells, red blood cells, mostly. Maybe there's one white blood cell. Can't see the platelets or anything like that. That's a capillary. Capillaries are just big enough to house a red blood cell. Like that. That's a red blood cell within a capillary. Okay. Let me just get in your face one more time. What time does this class end officially? Is it 12:15 or 12:10?
I think 15.
12:15. Okay.